Well, good evening, everyone. My name is Marianne Govea, and I'm the founder of Eric's House. Eric's House provides integrative grief care for people who have suddenly lost someone they love, and we specialize in suicide and substance-related losses. And I'm here tonight with Dr. Kathleen Benjamin Rickard. So Kathy is a member of the Eric's House team, and she's going to be discussing brain, breath, and healing. It's a fascinating presentation. We get so many positive comments on what she has to say. So before we get started, let me tell you a little bit about Kathy. She's a nationally certified family nurse practitioner with 23 years as a nurse practitioner and 35 years as a registered nurse. She has developed and presented a number of workshops across the country to address important topics in health and wellness. With an allopathic or mainstream medicine always in mind, she continues to learn how other modalities could weave into the picture for total health and healing. Now, a few other things about Kathy. She's an expert in hormone replacement therapy and functional nutrition. She has an ongoing study related to the chakra systems and energetic flows as it relates to disease. She's a certified Kundalini yoga teacher. She is a master Reiki practitioner, and she's a life coach to help train and motivate you through your healing journey. So Kathy, thank you so much for joining us tonight.
Thank you very much. Thank you.
All right, so I'll turn it over to you. If you want to go ahead and cue up your presentation, that would be great.
Okay, so again, welcome everybody. This presentation has a lot of technicalities to it. Don't worry about it. We'll just kind of float through. The point of this presentation is to understand within the brain. This is about the brain series. So this one is about grief and loss, and the brain and tools for self-care. And we find that that's a very important topic because for many, many reasons, including some of what we're going through today. I'm going to put this on a different mode. Hang on just one second. I'm trying to put it on the next mode. So hang on just a second. There should be a thing right here that says, hang on just a second here, sorry. Slideshow. Okay, hang on just a second. Okay, so it'll look more like a slideshow here. So the definition of grief, there's lots of ways to think about it. You know what it feels like to be in grief, but really there's a lot of research on it. It's a strong and sometimes overwhelming, usually overwhelming emotion actually, in response to a sudden or severe life event. This affects the brain, the body, and the spirit. It is an overwhelming to the whole self. What happens in the brain during grief and loss? What does it affect? How does it affect the whole body and mind? And ways to handle these emotions with self-care. This is what we're going to go over tonight. And why is understanding the brain so important? I think the biggest deal about this information is that if we can demystify the grief experience and the feelings that go with that, then we have a vital process, or we have an ability to use our mind to help us heal. When we're ready, we have a way to make ourselves feel well. It's never forgetting, but it's sometimes working through the grief that is how we heal in the world. So grief is a normal and common response to loss that changes how we perceive our world. Absolutely. Our response to grief is based on learning, genetics, and very much an individual process. There are several studies that say that things that may have happened in your youth are some of the stepping stones to how and why you process the things you do as you get older. It's not blaming, it's just how we use our mind to try to work on the past to help us understand how to move into the future. Our brain chemistry contributes to the spin, as I'll explain further on. And our thoughts contribute to our ability to heal and learn and grow. Here are some of the symptoms of grief. And many of them you'll feel if you have significant loss and grief and you've lost somebody that you love very much. These are noted too. But in some cases, even in a milder form, or maybe they think it's a most extreme form with what's going on with all the being on house arrest that we are in right now. I think these things apply in all kinds of ways. So in extreme exhaustion and headache, that dull headache you wake up with and go to bed with, feeling or getting sick. Our immune system gets a real hit when we're in grief, and many times we will get a cold or we'll get sick. Body pain, chest tension. There's an actual disease that is related to severe grief that actually causes a heart condition. There's also muscle and throat tension, and if you're under grief, many times you feel like you have a vice around your throat. Joint pains happen out of grief many times, and I'll explain some of that. Forgetfulness, shortness of breath, nausea, muscle weakness, dry mouth, clumsiness, a feeling of clumsiness, poor sleep, and poor appetite. And there are more, but these are many of the more significant ones people talk about. This is a picture of the brain. It's a little technical, but I like to put this one in. It's one of them that I do with almost all my presentations, because it helps to understand that there's parts of the brain that in coordination give us our wholeness, but in parts have an effect on us. The one on the bottom talks about the deep limbic system. That's where the amygdala is. So when I talk about the amygdala, or the fight or flight or freeze part of our being, that's the location of it. If you notice that near that, well, you wouldn't notice, but if you understand that the spinal cord is just right there, that's also part of the cranial nerves. And that's why when you're in an acute stress, you have a lot of symptoms that I'll go over later that contributes to the dance in that area called the amygdala. Also notice that parietal lobe on the side. We're going to talk about that in relationship to the hippocampus. The basal ganglia, we won't talk about as much now. It's the overall, everything is rosy kind of part of our brain. The anterior cingulate gyrus is a band that we will talk about, and it's part of the gateway to get to the higher thinking level, the calm thinking way of the prefrontal cortex. So we'll begin with the amygdala. That's in the limbic system toward the back that you saw, that's sort of wrapped into that spinal cord. This is the area of fight or flight or freeze. It's located near the cranial nerves so that it can affect our ability to see, hear, smell, and we also have palpitations from there. So the cranial nerves offer us the ability to hear and to see. It also helps the heart regulate. It helps us understand our world around us in that way. And this particular amygdala is very good at protecting us. So it's important that you know that this is not a bad thing. This is just a very protective thing. It's the first thing always that we get, no matter what the crisis, even if it was a small motor vehicle accident, let's say. Everything goes into the amygdala first before it filters out. And it's our ability to move on beyond that and train our brain over time that helps us move through it faster. This also has the painful emotional pain, I should say, not the physical pain in this case, but emotional pain of fear, anger, and sadness. That next area in the temporal lobe that I was showing you on that one picture is a very important one that we've done tons of studies on, really in relationship actually to Alzheimer's and inability to function as we age. Its job is to organize and store new memories. It consolidates the memory of emotion that first comes from the amygdala, and it tries to figure it out. It transfers that memory. It tells the brain, what are we going to do with this information, really? It's also the memory for directions, location, and orientation. This one is really interesting because I didn't really realize that when I was under severe stress and I was having a very hard time. I found that I had trouble finding my way to my own house. That's an example of what the hippocampus was doing. It was just not, I couldn't figure out, even in my own subdivision, what the heck and where was I. It was very odd, and I knew I wasn't understanding that, but I just wasn't able to figure that out at the time. I had to stop and slow down and just say, okay, here I am. And then hope my car could get me there. It has a very good capacity to neuroplasticity, and that's a lot of discussion right now. Neuroplasticity, neuronal plasticity, excuse me, related to early Alzheimer's. They're turning early Alzheimer's around a little bit with this information. It is also known that it can be regenerated, so you can build the hippocampus. When the further along in these memory problems, and if the tailspin of what's going on doesn't improve, we do notice it takes a while for that to turn around, but it is possible, and that's in the studies many times, that if we work at it, we can make it better. The anterior cingulate is the gateway to higher thinking. So it's that band that was toward the front there, towards that left side. It's the bridge from the limbic, or the fight, flight, or freeze system, to the prefrontal cortex. This is our area of yearning. We wish things were different. We want things to be different. It has to do with separation anxiety. It has a place of actual physical pain. So when you feel that awful, your body just hurts like crazy with your grief, this is the area that it is. It's a center of conscious regulation of the negative or the positive emotions with that pain. It enhanced healing through this. The anterior cingulate can be help you heal, actually, as a gateway through breathing, meditation, prayer, sound, music, play, singing, dancing, fun, things like that. If we can have our body do it, our anterior cingulate can appreciate it and help us to heal. The prefrontal cortex is in the front of the brain, in the front. It has to do with just the higher level thinking, really, planning for big deals, coordinating, multitasking, things like that. Decision making, or higher level decision making, not like, let's get out of the way of the car right now, but let's say if I go this way, if I do this and that, I'll avoid all that kind of problems in the future. It has a lot to do with impulse control. Can I just calmly help myself get through this step and make decisions to keep my body going forward? And this is found in the prefrontal cortex. It is contemplative. You think about things more in a more objective way than having a tail spin so much. It's actually available to you in that way. It's the seat of intuition, they call it, meaning that if you can quiet your mind, you can actually get some incredible insight in there. It's also the place of empathy, and it is called the just is place. So now we're going to move from the physiology, or the anatomy, really, of what's going on there, to some physiology. This is the chemical hormonal changes in grief. I'll go through it really quickly because it's not as much important, the details of it, as it is that how your brain works. It's really important to see it. The corticotropin releasing factor, it's called CRF, triggers the fear and related behaviors. It gets us going. So we get information from the amygdala, and off comes a hormone from the hypothalamus, and this is that hormone. And it's a chemical that says, do something, go, do something. That stimulates the adrenocorticotropic hormone, ACTH, from the pituitary. So now the hypothalamus has a communication with pituitary in relationship to this grief, to this stress, to this loss. It stimulates this hormone from the pituitary. Pituitary has a little conversation with the adrenal gland, which is right off of your kidneys. And that releases glucocorticoid, that's cortisol. So this is the story of what's called the HPA axis, the hypothalamus pituitary adrenal axis, and that's in the literature, always talked about when it's related to big changes in the body. So these things go in that loop. And so the adrenal glands, or the cortisol, then will elevate and try to protect us. But unfortunately, because of how grief works, and this is how our human mind works, it loops back to the hypothalamus again to add a little bit more CRF, and then the cycle keeps going around the circle. This is where the circles go, and it talks with the amygdala, which is your fight or flight, and you can get into these hypervigilant circles in your mind. From there, it goes into the hippocampus, and it triggers off into a continuation in a long-term hypervigilance and hyper alert emotions. It produces a norepinephrine to just keep that flow going. It says it's going to be a long-term problem. Let's just keep it going. So the point of this is that we have a real mechanism, and it's not, you're not making it up. This is something that has to happen. How long it happens and how deeply it happens, that's the individual part. But how the physiology works has been very well researched. It's very clear. Kind of a busy slide, but just to show you how this dances around so much. So the stress comes in, and it comes in really from down below. So you'll see it actually more in where the ACTH and the pituitary hypothalamus area is. The amygdala is attached to it. It's all kind of interwoven, and they all come together to try to protect you. Then you get a change in your heart rate, and you go, oh gosh, I'm really in trouble now. And then everything kind of cycles around again. The cortisol comes in from and adds to it. And cortisol initially is very protective, because it's giving you cortisone. It's just giving you a way to keep infection down while you're in acute state. It doesn't work in the long run, but it does help in the short run of things. So chronic grief, what we do know about it is that it shrinks the hippocampal volume. So if you have the hippocampus decreased in volume, you decrease that function of being able to get out of that spin. This is the area where they're doing a lot of research in the Alzheimer's world. So. Increasing the amygdala function is that fight, flight, or freeze, and it makes it into a hyperfunction. It just keeps on going. So it's hard to break the cycle, because the chemistry goes, oh, you need more? The chemicals, I'm sorry, it goes, oh, you need more? Okay, we need more, we need more. And it believes whatever your thoughts are. So your mind is, and your brain is trying to protect you and take care of you. So understanding that that's true, sometimes we can come to a place where we can make a decision to get a break from that. The other thing that chronic grief does is it decreases the prefrontal cortex function, and that's our higher thinking function. So that's when we can't possibly think outside the box. We can't be still. But that's in our mind, and that's the chemical. But our thoughts can do some things like that, and we'll talk about it. But it gives a stuck feeling and that spinning thoughts. It goes round and round and round, and you see something on TV and it gets worse, and it just goes round and round and round. And you hear a friend that talked about the person who you love that died, and that goes round and round. And so it goes spinning around in circles. The cortisol increases and then decreases. Cortisol at first is a protective, so it actually decreases your pain for a little while. If you've ever had to move really fast, you'll notice that your back didn't hurt then, and then if you had back pain. And then if it came back and you had that, you pushed and pushed and pushed in the grief process, you'll have pain. And it also causes a fatigue and a dizziness, and that's coming from the adrenals. They can only push out that hormone just so much. And they start to drop it down. I will often do a DHEA level, because I'll look to see how long someone has been under adrenal fatigue. And that DHEAS level can tell me a good story about when things start giving you trouble and how long it's been around. The last thing is a disconnection, very, very much wanting to be alone and quiet. And not all of that is bad. It's just that with chronic fatigue, not being connected with other humans doesn't help us get out of the circle. So here are ways to relieve that stress. First of all, most important is understand that what happens in the brain affects the whole body and the mind, and also that grief is a normal, healthy life event. It's what we do as we get through the grief that defines how we're going to feel on the other side. One of the things that we talk about is making a date for exercise. So on the calendar, it says, I will go out with somebody and go hike for 20 minutes or something. And then just make a pact with somebody else, or decide you're just going to do 10 minutes of jumping jacks or something every single day, and it's on the calendar. The reason is because if you step out of your brain and you put in a thought, the thought will allow you to have a different feeling in the brain. So it's our thoughts that help our brain know what the game plan is. Build a compassion in your heart. Find somebody to give to, or to serve, or to help. Sometimes getting outside of your world, no matter what, is helpful to others, and it helps make a big difference in yourself as them. Connect to the earth. There's a lot to talk about with earthing, and there's a lot of talk about making your body feel better with the electromagnetic field of the earth. So gardening and hiking and boating and swimming and things that are outdoors help with vitamin D. They help with just seeing color again. They help getting you out of the box. Give some space in your day for laughter. Some people will actually turn on a comedy. They may not think it's funny, but there'll be something in there that'll just have a break. And if you can just find a way to reboot for a minute, it helps a lot. If you're not sleeping well, give yourself permission to take a nap. If you're oversleeping, give yourself permission to always get up at the same time in the morning. So if you don't sleep till 3 or 4, but 7 o'clock is when you would have normally risen, get up at 7. And then you could take little naps during the day, because that increases your melatonin. And melatonin helps an awful lot with mood, and it helps you feel better. So if you don't get enough sleep, and some people in grief have to sleep a long time every day, because it helps their body to get the break it needs. Otherwise, their mind spin just makes the body feel so uncomfortable. So don't be afraid of sleep. So there's some more ideas. Keeping a dream journal. Speaking of sleep, dream journals are important because it helps us understand the repetitive thoughts. Many people say, I'm afraid of sleeping because I don't want to have that dream. It's like, well, go ahead and write it down and see what that repetitive thought is. And then have a conversation with a therapist and say, well, this keeps going around in my head. How can you help me with that? And really talking is big deal. Get it outside of your mind spin. And sometimes you can get a snap at really looking at it slightly different. So talking to therapists and groups. This group here is a big way to help you feel a little bit better, just to know that this is a normal but just spinning kind of thing going on in your brain. That helps to break the spin cycle. All those things do. Change your relationship with your thoughts. This one is tricky because there's a lot of attachment and a lot of you want to hold on. You have that yearning to hold on to what happened. And if you could allow yourself to have a moment away, like step out, watch that train go by for a minute and step out, one thought at a time, one time a day. Just say, for one moment, I'm going to pause that story, and I'm going to have a pause, and I'm going to be okay. And I'm going to say, you know what? I'm breathing. I can see colors. The roses smell nice. I can see the sky is really blue. I have a moment. So let me have that moment. You can do it really well with the breathing technique, and I'll just show you a brief one. You can do it by having some other kind of experience. You could go to church. Right now you can't, but I guess you could watch it on TV. You can watch different things that are moving, and I'll give you a feel outside of being stuck. Meditation improves your mood. That's well researched. There's no question about it. I put meditation and prayer as almost interchangeable. In truth, meditation is a receiving and prayer is a putting out. So put out your prayer to the highest good, and then have a meditation on that prayer and just watch and see what happens. Just the breath and slowing down. So it improves your mood. And the brain has a chance to temporarily stop that processing of what's going on with the grief symptoms. And if you have a temporary stop, it's like a reboot. And then you can kind of relax into it and say, okay, my body's still safe. I'm still safe. Let me just have this moment to make things feel better. Add creative projects, any creative projects. Good time for ceramics. I remember ceramics teacher saying it's one of the best therapy to get rid of the anger and the angst is to just knead some clay. But maybe you're a bread maker, so you can knead some bread. Something that gives you some release is what I'm talking about. Music, I usually say music without words, because music without words allows you to calm your nervous system down by the vibration of it, actually. So Mozart and all those are good, but anything that you can listen to that you enjoy that doesn't have a lot of voice to it. Hard drumming sometimes increases anxiety because it's vibrating on a different kind of level. But if you can do some things of drumming which are more balanced, that would be great. Breathing techniques are very important, and that I can't tell you enough about it. That was my doctoral work. If you can teach yourself to drop your shoulders and expand your belly to breathe, so you're inhaling and exhaling from your abdomen, let's say, it's called a singing breath or a diaphragm breath or a baby breath. It's got different terms, but the idea is that it expands and contracts. And allows that muscles to calm down, and then it allows the vagal nerve to calm down. It makes a really big difference for you. And then I bring in the gong, because tonight we're going to play a little gong. I'm going to have you close your eyes and just take some breaths from your belly as best you can. We're going to feel how that feels. One more thing is the proclamation. There's a proclamation of intent to learn. It's a long term and it sounds too fancy, but really any proclamation, like I am proclaiming that I will be happy. I don't have to prove to anybody how sad I am. I'm going to prove to myself that I can have a moment of grace. I can have a moment of peace, and that's what I'm going to do. And make that a part of your daily practice, and you'll find that that can slowly expand and help you to cope when times are extra stressful for you. Meditation and prayer. So there's lots and lots of research on it. It provides better focus. And if you can improve your focus, then you improve your hippocampus and you can find your way down the street. It decreases your anxiety, meaning it decreases the amygdala. And if you have that ability to get off the fence right away and just say, okay, wait, let me breathe through this and see. Let me slow myself down and think about this, not in a tailspin, but in an altruistic way. You can get a little snap and benefit. It decreases pain, because if you can breathe through that and slow it down, it definitely has pain receptor sites that are improved. Add creativity. It adds creativity by giving yourself a moment for intuition. What would I like to do today? And it really gives better memory, again, based in the focus. They found in research that there more gray matter was produced with meditators, and that leads to more positive emotion more often. It doesn't mean that you won't have all the emotions that every human has, but you'll have more ability to reach that neutral emotion. And in decreasing the amygdala response is similar to decreasing the anxiety. They're very similar. One of the instruments that is historically done, ancient times, are the healing sounds of a gong. So they use gong in all kinds of ways, but some of it is meditative and healing and rituals and, in the past, many millennia back. We find that the vibrating metal, so this is made somewhat of bronze, so bronze seems to have a particularly nice charge to the human body, but it vibrates the metal charges of the electrons in the environment, and it picks it up in the environment from the sounds of the metal. It merges then with the electrons in the body. This is a safe thing. This is an important thing that kind of recalibrates all those fiery hormones and chemicals. It recalibrates the parasympathetic nervous system to be calm. So you have an opportunity this way to actually use a tool to calm your mind for a minute and get a break. It doesn't change the grief. It just helps to give you a moment so it can be softer. It is a positive experience, a peaceful electrical charge to reboot the emotional block. And the body feels the vibration of sound in all the cells for neutrality. And I've never had an experience with the gong that I didn't feel it somewhere in my body, like I could feel it in my chest or my joints, maybe if I was having a painful day that way, and sometimes in my mind. But I always felt calm afterwards. So we're going to do the gong in a minute, and if there's any questions, we'll go over those. So really important though, and this is using your thoughts, because your brain doesn't really want food necessarily. It's not easy. It's not easy under grief to eat, but the thoughts help to keep that stress down by getting a regular food in. So the big deal is about real foods. So we know that there's a lot about genetically modified foods and Roundup particularly that causes stress, anxiety, and it has some cancer-causing effects. So we try really hard to say, all right, I can't always afford organic, but let me just at least try to eat as clean as I can. And a lot of it is not, you don't have to go and buy very expensive foods. But I ask that you read the labels. If you can't understand what the labels say, if the ingredients are that big, maybe don't eat that one. Go to something else. I can find chips really easily that have 5 ingredients. Most of the time it's at a place like Sprouts, but I'm seeing more and more of it at Fry's too. I do a lot of looking around for that because that's kind of the most functional way of doing it. Dark greens, fresh fruits and vegetables, organic of those things if you can. There's a group called Environmental Working Group, and you can look them up, Environmental Working Group. And from there, they will tell you the cleanest and the not so clean. So they call it the dirty dozen and the clean 10 or something, that are foods that are typically easier to get a hold of and eat that you can have. The Mediterranean diet has been studied in all kinds of ways. And it's basically of organic protein and a good fat. So like a lot of avocado, olives, and things like that. Coconut are good. Fish and fish oils, and green food, but not a lot of the refined carbs. Not a lot of breads. Although Mediterranean has bread in it, we just kind of don't do big time breads. More of a minimizing of that, and heavy in the vegetables and fruits and protein and the good fats, the beneficial fats. Eggs are back in. All those things are good for you. This kind of a diet stabilizes the insulin, the blood sugar, which of course are related, the cortisol level. So if that's what's streaming around from your fight or flight, it can actually help modify that a little bit, give you a little modification through your digestion. Omega-3 fatty acids, or the fish oils, I would recommend getting clean ones. Omega-3s, you can find them online, maybe Metagenics or Full Scripts, places like that have them. But I would get a good product. It's hard to buy now because of the heat, but I kind of stock up around March and April, make it through the summer, and then I buy it again. I don't like it to sit around outside too long, and I keep it in the refrigerator. Turmeric is well researched. Berries, mushrooms, coconut teas, fermented foods. Ashwagandha is an interesting one. It's been studied in calming the nervous system. Vitamin D, methylated B vitamins. There's plenty of studies that the MTHFR gene and the associated COMET gene related to an inability to methylate your foods. In other words, your inability to really digest your foods properly has caused a lot of anxiety and a lot of depression issues. And so methylated B vitamins help get that into the cells better. Your gut microbiota is huge. Gut-brain health is a big deal. That which is healing in the gut also talks to the brain through neurotransmitters like serotonin and dopamine. So those things are probiotics, and you can get those in capsule form. They don't have to be too fancy. I always say switch them up, get one package and then get another. Fermented foods and kombucha. Those are just examples. So that's the end of the slide presentation part. What I'm going to do is play the gong for you. But I want you just to have a nice deep breath and sit tall with that. If you're in a place where you can lay down, you're welcome to do that. I'm going to be playing softly because this room may resonate very loudly. But I'm going to play for until the gong says to stop, actually. So we'll play for a little bit, and then if there's any questions or if you have any concerns. But what I ask for you to do is try to breathe in through the nose and out through the nose. leaving your shoulders alone. Breathe in through the nose and out through the nose. And while you're listening to the gong, feel your body. Listen to your ears. Do you hear birds? Do you hear churches? What do you hear? What do you know? And feel your body and tell yourself, really, where is that feeling? Where am I feeling this right now? It's a good cue to help you understand that you're soundly working the body. Then you can take a deep breath into that body part that you felt from the gong, and you can feel yourself heal a little layering of feeling from that. So I'll turn my little camera over to the gong, and we'll start. So if you can lay down, do so. If you would rather be sitting, do so. Eyes are closed is usually nice, because then you are allowing your body to just absorb all the sensations. And we'll begin. Take a deep, deep, deep breath in through your nose. Fill your whole body and every cell with the rejuvenated strength of the gong sound. And then exhale, let it go. Fill up your lungs one more time, nice and full. Feel where it resonates around your body. Feel what part of your body got a bath. And exhale. One more time, deep, deep, deep breath. Fill it up full. And move your body around. And exhale. I wish you well. And I hope you have forgiveness for yourself for all the crazy stuff that goes on in your mind with your grief, because it's real and your brain is doing it and it will do it. And now you maybe have an idea of how your thoughts can help your brain. You take care.
Kathy, thank you so much. I am just amazed at how much knowledge you're able to impart. I do have a couple questions for you, though. By the way, the gong was beautiful. Thank you so much for that, too.
Good.
I have a question. You know, in your early slides, you talked about the brain doing all this stuff to protect us. And we've often heard that, you know, if your brain processes everything all at once, you could literally die from a broken heart.
Yes.
So explain that a little bit.
Well, there's an actual phenomenon. I was trying to remember the name of it. It's like Tzitzi heart attack, something like that. It's a real thing. What happens in grief is that the autonomic nervous system plays it. So the vagal nerve. So it's all about the amygdala that I was describing, and around there are the cranial nerves, and one of them is the vagal nerve. And the vagal nerve is that one that's just really super fiery, and it kind of travels all the way down around your heart, down into your belly. It gives you that knot in the stomach. It gives you that icky feeling in your chest. And you really have, it is a real extreme case, but it is absolutely documented well that you can just get so much tension from that vagal nerve,
Okay.
especially with people that live in a little bit of stress as a baseline. Their vagal nerve is just like ready to go. Your blood pressure can rise, your breath isn't getting deep, so you're not getting enough oxygen, and the vessels in your heart can just spasm.
Mm-hmm. Okay.
That's the literal part of that kind of a heart attack. It's not common.
So it does take me to the next question then. You said something about adjusting your thoughts when you're in that state of fight, flight, freeze, or whatever. You're adjusting your thoughts, that your thoughts can actually help your brain change what your brain is doing at that moment. I think that's really important. But you also said that talking interrupts the spin cycle. And many of our clients, the things we tell our clients inside Eric's house is to continue to breathe, just breathe, 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 especially as it relates to anxiety, but also talking, because we know that talking through whatever it is you're feeling or thinking helps get the grief process through the brain.
Yes, and that I did mention at least that's part of it. Whether you do your journaling, part of it is journaling, but also to talk. You know, seeing people and going through that process helps you to just hear it for what a little bit different than what that spin in your brain goes round and round.
Yeah. So it just gets it out of your body, somewhere else.
Yes.
So you can have a different perspective about it, or just get it released.
And the breathing part is vital to it. But a lot of times it's a misunderstanding that just breathing is all you need to do. But if you breathe with your lungs like this, like you're going, you've seen people try to breathe and they just get worse, because that changes the autonomic nervous system and gears it up. What you want to do is relax this so that the phrenic nerve drops, and that changes the vagal nerve. That darn vagal nerve is part of the sneaky bugger. Okay. And if you can get the diaphragm to drop by just making your whole chest calm and soft, and then breathe out in and out from your belly like a baby would, for just a minute. It can flip it in just a minute.
Change everything.
Yep.
Yeah. Okay, well, gosh, there's so much to talk about. I'd like to do a whole nother presentation just on breathing.
I know, right? I got plenty of data on that. That was my
Okay.
doctor work, so I got tons on that.
Well, we're so blessed and honored to have you, Kathy, and thank you so much. And I hope you have a wonderful evening. And if we get any questions, I'll send them your way. For people who would like to reach Kathy at her website, it's healgracefully.com. So you can reach out to her directly, and you can also find her on our website at www.ericshouse.org. So thank you very much for being with us tonight.
Thank you for inviting me. I appreciate it.
Bye-bye.
Bye.